remarks. So, Dr. Tedros, you have the floor.
Thank you, Margarita. As you said, greetings from Bali. Good morning, good afternoon, and good evening. Today, I'm joining you from Bali, Indonesia, where the G20 summit has just concluded. Over the past 2 days, I have had the opportunity to meet with several world leaders and to address the summit itself. My message was that as the COVID-19 pandemic has demonstrated, when health is at risk, everything is at risk. Conflicts around the world, climate change, and global crisis in food and energy security have now overshadowed the pandemic as the most pressing issues for world leaders. But each of these crises has profound implications for health. The lack of food and energy or their overconsumption can have severe consequences for health and economies. Protecting health against the impact of this crisis is essential, but it also helps to protect economies and societies. I congratulate the G20 leaders on the adoption of their declaration, which includes strong support for health and health security. The G20 leaders said they remain committed to a healthy and sustainable recovery from the pandemic and building towards achieving and sustaining universal health coverage under the Sustainable Development Goals. They reaffirmed their commitment to strengthen global health governance with the leading and coordinating role of WHO. They expressed support for the work of the Intergovernmental Negotiating Body, which is negotiating the pandemic accord. They extended the mandate of the G20 Joint Finance and Health Task Force, which is critical for ensuring adequate financing for pandemic preparedness and response. They expressed support for the work of the WHO mRNA Technology Transfer Hub in South Africa, and they welcomed the establishment of the new pandemic fund, which was launched in Bali on Sunday. Yesterday, WHO also signed an agreement with Indonesia's Ministers of Health and Defense to establish a new training hub for emergency medical teams to boost national, regional, and global readiness for health emergencies. I thank Indonesia for its leadership as president of the G20 this year, and we look forward to working closely with India next year. Now, an update on the Ebola outbreak in Uganda. Since we briefed you last week, there have been 6 more confirmed cases and 1 probable case of Ebola in Uganda, bringing the total to 141 confirmed and 22 probable cases. There have also been 2 more confirmed Ebola deaths and 1 probable death, for a total of 55 confirmed and 22 probable deaths. 73 patients have now recovered. The government's efforts to respond to the outbreak have slowed transmission in most districts, and 2 districts have now not reported any case for 42 days, indicating the virus is no longer present in those districts. However, in the past week, the district of Jinja reported its first case, becoming the 9th district to be affected. WHO and partners are supporting the government to intensify detailed case investigation, contact tracing, community engagement, and infection prevention and control measures. Since the outbreak began, the government of Uganda, together with researchers funders, companies, regulatory authorities, and other experts have been working under a global effort coordinated by WHO to accelerate the development and deployment of vaccines for use in trials. Today, I'm pleased to announce that a WHO committee of external experts has evaluated 3 candidate vaccines and agreed that all 3 should be included in the planned trial in Uganda. WHO and Uganda's Minister of Health have considered and accepted the committee's recommendation. We expect that first dose of vaccine to be shipped to Uganda next week. A separate group of experts has selected 2 investigational therapeutics for a trial, as well as a trial design that's now being submitted for approval by WHO and authorities in Uganda. Tomorrow, I will travel to Qatar to participate in the opening of the FIFA World Cup to highlight how major sporting events can contribute to improving health around the world and drive progress towards WHO's goal of health for all. The World Cup is one of the greatest shows on earth, with an estimated audience of 5 billion people. WHO is working with Qatar and FIFA to deliver a healthy World Cup with a range of activities to promote physical and mental health for all people in Qatar and around the world. Together, we have designed measures to reduce the risks of disease spreading at the World Cup, including COVID-19. We're promoting healthy food options at stadia and fan zones, and we're conducting a study on ways to influence consumers to choose healthier food options. And tobacco use is banned in sitting areas inside all stadia. We're also working with FIFA to promote physical activity, healthy diets, and other elements of healthy living to the World Cup's global audience with pitchside advertising boards, videos in stadia, and fan zones, extensive messaging on television and social media, and more. Lessons learned from the World Cup will also be shared with the International Olympic Committee to support preparations for the Paris Olympics in 2024 and the Milano Cortina Winter Olympics in 2026. WHO's Goodwill Ambassadors, Alison Becker, Brazil's goalkeeper, and former Cote d'Ivoire striker Didier Drogba will be supporting our work. Finally,